Ladies and gentlemen, good day. My name is LJ Stanbrook. I'm the presidency of the World Affairs Council. Welcome to the World Affairs Council Charlotte Distinguished Speaker Series. Today, we're delighted to have with us Dena Diorio, who is the Mecklenburg County Manager, and she will speak to us for about an hour at this point of time. As you know, the World Affairs Council is a nonprofit, nonpartisan organization. We discuss topics that are of importance to all of us, with a special focus on global and international topics. We're delighted to be able to continue providing our mission in this difficult situation that we're all facing, and we're delighted, absolutely delighted, that today's program is sold out, fully sold out. So please note that your microphone will be on mute and your camera will be turned off for the duration of the presentation. To submit a question, and we will have a question and answer area part of this program, at any time, please use the Q&A function box in the Zoom toolbar. The question and answer box in the Zoom toolbar. Do not post your questions in the chat area. Please post it in the question area box in the Zoom toolbar, and Dena will be happy to respond to your questions. This presentation will be recorded, and we will be sending it to you via the World Affairs Council Charlotte mailing list. So make sure you're signed to receive our emails. Next slide. So this is the biography of Dena Diorio. I will not go through it. We all know Dena. What I will say in one sentence, I will summarize. We are very lucky to have Dena here in Charlotte as the Mecklenburg County Manager. Next slide. Thank you so very much once again for being with us. And if you like this program, please do take a moment to donate. It's tax deductible to the World Affairs Council Charlotte, because we do want to continue our service to the community in providing these debates, discussions, and programs in the future. Dena, the world was difficult and your job was very demanding. And I know personally you were extremely busy even before COVID-19. Now with COVID-19, the world has turned upside down for all of us. We can only imagine the pressure and the work you have in front of you. So we will minimize our time talking as a moderator, and we'll turn it over to you to tell us more about what is it that you are doing, what is it that the county is doing, and what we can expect in the future. However, very importantly, I would like to ask you a private question, a personal question. Dena, how are you coping? What are you doing? What does your day look like in these dire and difficult times?
Well, I mean, I'm home most of the time. Today I'm in my office because I had some things I had to do here, but I, like everybody else, is spending my time at home. I'm working a lot, 7 days a week, but you just have to continue to, you have to continue to push forward and, hope we get to the other side. But it's been busy, and, I try to walk a little bit and play a little golf and, try to spend some time outside, but, it just keeps me busy, and this is what you sign up for, and I love what I do, and I want to do what I can to keep our community safe. So, but thank you for asking about me.
Thank you, Dena, and thank you for all you're doing to keep our community safe and battling this global pandemic. So without further ado, we will turn it over to you, and we're looking forward to your presentation. Thank you.
Thank you. Thank you, LJ. Thank you so much for having me today. I really appreciate it. And if that picture is any indication, you can see I need a haircut just as much as everybody else needs a haircut. So hopefully we'll get to that place soon. But what I thought I would do today is just kind of walk you through, where we started and where we are today, and the decisions we had to make, and how our case count began to grow, and just to give you a feel for what it's been like for us to try to manage this pandemic. And so what I will tell you is that we started to plan for this virus before we had our very first case here in Mecklenburg County. And when you look back in retrospect, it feels like the last 60 plus days have been around 8 months. That's how long it feels for us, and how much we've learned, and how much the guidance has really changed over time. On February 28th is when we actually started our planning efforts. And the first thing that we did was we took out our pandemic influenza response plan, because that's all we had, and we try to update it with the CDC guidance that was available at the time. And if you remember, the original focus was on travelers returning from international travel, international hotspots. And at the time, again, the CDC indicated that the risk of COVID to the health of the general public was low. That was the guidance that they were putting out. And as we can know now, 60 or so days later, we know a very different story. And the efforts that they used to contain the virus at that time was really screening and prohibiting travelers that were returning to the US from overseas, which was meant really to prevent community spread. But we knew we would have cases here because we have people who travel here. So we started on March 6th, and I activated what we call the policy group. And the policy group includes obviously our public health team, emergency management, Charlotte Mecklenburg Police, Atrium Health, Novant Health, Medic, Charlotte Mecklenburg Schools, our sheriff, our courts, the city of Charlotte, and our 6 towns. And the policy group is really charged with making all of the decisions collectively that we needed to make in order to respond effectively to the virus in our county. And one of the things that we agreed to do early on was we needed to stay aligned, because that policy group, if we started to splinter or couldn't hold it together, it would really impact our ability to be effective. On March 9th, we opened our Emergency Operations Center, and that is sort of our incident command structure. And the benefit of having an Emergency Operations Center is that allows us to access resources from the state and federal government. And the Emergency Operations Center is run through the City of Charlotte's Fire Department. And so we activated on March 9th. And one of the main reasons we did that was because, like everywhere else in the country, we didn't have access to personal protective equipment. We knew we were going to need that. And we needed to start understanding where we could access PPE in order to be able to move forward effectively. And it was really emergency management who has the ability to go up through the State Office of Emergency Management and then ultimately up through the federal government to be able to access and procure the supplies that we thought we were going to need here in Mecklenburg County. There was also the issue of testing. If you remember, we had very, very little testing capacity at the beginning. And the only people who could get tests at that time were people who had been traveling overseas, who had exhibited symptoms and that tested negative for flu. So it was a very, very small number of people who could be tested because our testing limitations were very, very significant. And then we also started to do some scenario planning about medical surge. We wanted to know what would happen if we had over 1,000 cases flood our hospitals at one time and what that would do to our healthcare system. So we started to look at those things to start again to plan for what we might happen in the future. And the other primary goal of our policy group was communications, because we knew that it was really important to the public that we have consistent, clear messaging about what was happening in the community to make sure that we gave people the appropriate guidance to stay safe, and that we gave people a sense of confidence and assurance that we were on top of the situation and that we knew what we were doing. And so to that end, we actually activated our Joint Information Center, which we call the JIC, which is a room full of public information professionals from across the county that really help us field questions from the media, answer questions to the media, answer any other kind of requests that we get, but also craft all of our messaging as it related to COVID-19. The policy group meets 7 days a week and has been doing that since the very beginning. It was only until this week that we started to scale back the sort of attendance of our calls. But we have been meeting 7 days a week since March to make sure that we knew exactly what was going on and we stayed connected every step of the way. But at the same time that I was bringing up the emergency public health infrastructure, I also had to start planning for COVID-19 as an employer. Mecklenburg County has 5,700 employees, and we provide critical services to the community. Many of our services are mandated, which means we have to provide them no matter what. We had to continue providing certain services to our community, and we had to figure out how we were going to do that. So on March 6th, I assembled what I call my core team, which includes my 4 assistant county managers, human resources, information technology, public health, public information, legal, and facilities management. And the first thing that we did is we activated what we call our continuity of operations plans. Every department in the county has a COOP plan, and the COOP plan is designed to make sure that you can continue service delivery when one of your facilities is not available. In this case, this is the first time that every single department had to activate their COOP plan at the same time. These are generally reserved for when we have, hurricanes or tornadoes where certain things are out, other things are still working. But this is the first time that our COOP plans had to be activated countywide. I also activated a level 2 crisis, which is consistent with our crisis management plan. We have a crisis management plan for Mecklenburg County that really helps us understand the level of communication we need to be providing to the public depending on the severity of the crisis we're dealing with. And at the time that we activated, this required us to do a lot of communication to the public and to my Board of County Commissioners about what was happening with COVID-19 in Mecklenburg County. So for us, the crisis began on March 11th. That is when we had our first presumptive positive case of COVID-19. And back in March, we used the term presumptive positive. And presumptive positive meant that you demonstrated symptoms, you had traveled abroad, you tested negative for the flu, and you were tested for COVID. But at that point, the assumption was that you had it. And the reason for that was because at that time, all of the tests were being sent to the state lab, and the turnaround time was incredibly slow. We were waiting for weeks to get the results of these COVID-19 tests. So once you were presumptively positive, you were sent home for isolation for the 2-week period, whether we ever knew whether or not you ever had it. But that was the presumption at that time, because there's no way we could make any other determination because the test results were coming back so slowly. On March 10th, Governor Cooper declared a state of emergency in North Carolina, which allowed the state to access federal and state emergency management funds. And then following that, on March 13th, Mecklenburg County declared a state of emergency as well, which allowed us again to access state and federal emergency management funds, but also allowed us to mobilize our emergency management functions. And there's a whole ordinance around emergency management functions in Mecklenburg County, and it allows us to do things a little bit differently than if we were not in an emergency situation. And it gives us a lot more flexibility to do things than we normally would otherwise. And so that was very helpful for us. And at that time, on March 13th, when we did our emergency declaration, we had 5 presumptive cases of COVID-19 in Mecklenburg County. On March 14th, our public health director actually issued a public health order prohibiting mass gatherings. That was one action she could take unilaterally as the public health director on behalf of the entire county. And again, just to give you a sense of where the guidance was that time, and this was based on CDC guidance, that the order defined a mass gathering of number of people of 100 or more. And so we know today where we are on May 14th, 100 or more is clearly not where we are as it relates to mass gatherings. So again, the guidance has changed significantly as we move forward and as we learn more. And on that date, we actually had 7 presumptive positive cases in Mecklenburg County. There are also some other decisions that we were making as we moved through this. One was we knew that our homeless population could be very negatively impacted by COVID-19, and we needed to take some special steps in order to protect them. So we did a couple things. We rented hotel rooms. One hotel room was to be able to allow us to do additional social distancing in our homeless shelters. So we moved a bunch of people out of our homeless shelters to allow them to appropriately social distance. And then we had another hotel, which was for isolation and quarantine. So if we had a homeless individual that was either exhibiting symptoms or may have been exposed, they were put into that hotel for quarantine until they could be tested, and we could determine whether or not they were positive. The other thing that we did is we started to provide, open up childcare centers in our park and recreation centers for families of essential workers, healthcare providers and essential workers, because we know once school went out and essential workers had to go to work, some would really be in a place where they needed a place to put their children. So we opened up childcare centers to make sure that families felt safe, that they had their children in a place where they'd be well taken care of as we move through this pandemic. The other thing that started to happen is we started to get a number of requests from folks that wanted to volunteer. They wanted to volunteer time, they wanted to volunteer resources. So we activated what's called the VOAD, and the VOAD runs out of emergency management, and that stands for Voluntary Organizations Active in Disasters. And they have done an incredible job managing the volunteer effort in Mecklenburg County. There has been $18.6 million raised through VOAD and the Foundation for the Carolinas and the United Way of Central Carolinas, which is granting dollars to nonprofit organizations to help provide basic needs in our community. And there are 210 organizations participating in the VOAD at this time. And if that's something that you're interested in, there's a website called sharmecresponds.org. That is sharmecresponds.org, and you can donate money, you can donate time, you can, if you have PPE that you want to donate or sell, you can do that all through that website. And that has been one of the great successes, I think, of this pandemic, is the way people have really stepped up to try to help people in this community. On March 17th, Mecklenburg County officially closed for business. We have to continue to provide services, but we basically went into a virtual government situation. Deployed over 1,000 laptops and equipment to allow our employees to work virtually and continue to provide services to our community. And on that date, we had 17 presumptive cases. And on March 20th is when we started to have conversations about whether or not we needed to consider a stay-at-home order. We had continued concerns over our lack of PPE. We didn't understand, what was happening with testing, because we had 3,000 tests that were pending, but again, the results weren't coming in, and we didn't really have a good feel for, what the virus was doing in our community, and that was a great concern to us. And again, we saw what was happening across the country, places like California, Washington State, New York. And so we were very concerned about what we were seeing and wanted to make sure that we stayed ahead of that. The other thing is, on that date, we had 45 presumptive cases. And while that might not seem like a lot, we went from 17 cases on March 17th to 45 cases on March 20th, which means that the number tripled in 3 days. And we were very, very concerned that if that tripling kept happening, we would be in a very, very bad place very, very quickly. So on March 22nd, our public health director, who is the incident commander for this pandemic, agreed that we should consider going forward with the stay-at-home order. The order was developed by the county, the city of Charlotte, and the 6 towns, because we are all the signatories of these stay-at-home orders. Our order was crafted based on what we saw in other places across the country. We looked at San Francisco as a great model. The state of Illinois was also a really good model. But we did have some concerns about this. We had some concerns because we didn't really feel like we had good data to support making the decision. And we needed additional data from the hospitals regarding their surge plan, their PPE inventory, their burn rate of PPE, which is a really big indicator, and their testing capacity. And so we were able to pull some of that information together to help us make that decision that we needed to go forward with our stay-at-home order. And on that date, on March 22nd, we had 80 presumptive cases. On March 26th, our stay-at-home order went into effect for 4 weeks until April 16th. We were the first county in the state of North Carolina to move forward with a stay-at-home order. And this was a really pivotal point for the city, the county, and the 6 towns, because the county, the city, nor the 6 towns can bind each other. And at any other time, anybody can peel off and go in their own direction. So it was really important that we stay aligned, that we were coalesced, and that we were very responsive to the needs of the elected boards for which we all reported. And so we were very, very adamant about making sure that we stayed aligned during this process. And on that day, on March 26th, we had 230 presumptive cases. We issued our stay-at-home order. We had to stand up a call center. We had to prepare frequently asked questions. We did a series of press conferences, really trying to educate the public about what the stay-at-home order meant. And then on March 30th, Governor Cooper announced his stay-at-home order, and that went into effect on March 30th, and his was slated to expire on April 29th. The state's order was actually modeled after Mecklenburg County's order. They are very, very, very similar, but it was a little bit less restrictive than the one that we had here in Mecklenburg County. There were certain businesses that we deemed non-essential that the governor deemed essential. Examples of those were realtors, auto dealerships was another one, and we had a lot of conversations with those industries about their inability to compete with surrounding counties because our order was more restrictive. So we had to do a lot of work with them and try to craft ways that they could operate, but operate safely, and take away that competitive disadvantage that our order had put in place. And at that date, we had 376 presumptive cases in Mecklenburg County. The other thing that we discovered soon after the governor issued his order was that the Department of Revenue was given the authority to issue letters to businesses deeming them essential or deeming them not essential, but allowing them to operate. So as we started to talk about enforcement, we had Charlotte Mecklenburg Police, the 6 town police departments, and the sheriff's office that worked very closely together to make sure that we interpreted the order consistently countywide, and that we enforced it consistently countywide. The primary way we were going to do this was by voluntary compliance. And so the police departments followed up on every single complaint we got, and they encouraged people to voluntarily comply with the order. But then we started to see all these Department of Revenue letters popping up saying, well, I have a letter, I can operate, I have a letter, I can operate. So I lobbied the governor's office, and I was successful in getting a letter from them saying that even though you get one of these letters from the Department of Revenue, you have to follow the local order that's within your county. And that allowed us to be able to enforce our order consistently across the county, even though we had some of these letters floating around out there that were giving people the ability to operate. We did get sued. We had one industry that decided that it wanted to convert itself from a certain type of industry to a convenience store, because convenience stores were allowed under the governor's order and allowed under our order. And so they tried to convert themselves into a convenience store, and we did not let them operate that way. And then they went to court attempting to get a temporary restraining order, and they were not successful. So we were able to keep them closed during the duration of our order. But this was also the time that we really started to get focused on the data. The two hospitals were collecting data, the county was collecting data, and we were looking at a lot of different data sets. So we really needed to come together, reconcile those data sets to be able to look at the total number of positive tests that we could get, but we couldn't get things like hospitalization rates and some other things, ICU capacity, vent capacity. These were all things that we needed to see so that we could start to do what was called this curve data. I think everybody's heard about the curve, and really needing to understand what the curve was telling us, when it was flattening. And so we really had to come together and start looking at the data. On April 2nd, we got a letter, or I got a letter from Gene Woods from Atrium Health and Carl Amato, president of Novant Health, asking us to build them a field hospital. You may have heard a lot about the field hospital in the news. And they wanted us to build a hospital for an anticipated surge of 3,000 COVID patients. And that was what the curve was telling us at the time. The curve indicated that we would reach our peak of cases in late April, which would have totally overwhelmed our healthcare systems. So we started looking at places where we could put our field hospital. And we initially were focusing on, if you remember, UNC Charlotte. So we were going to convert 7 dorms to create 2,028 non-ICU COVID beds. The Army Corps was going to build that. They were prepared. They were going to build it out. They were going to head and construct it and upfit all of the rooms. We were getting ready to pull the trigger on that plan when we heard back from FEMA, and FEMA said, Army Corps will build you a field hospital, but we will not be able to provide you any assistance in staffing that hospital or supplying that hospital. And that included ventilators and PPE, because at that time, things were really exploding in other parts of the country, and there was not enough to go around. And so they said, if you want to do this, you can, but you're on your own. We were a little nervous about that. But on that day, we had 528 positive cases in Mecklenburg County. And so then after further consideration and doing additional data work, the hospital sent me a letter on April 6th and said, we have worked really hard to build surge capacity within our 4 walls. And we've been able to do that to some extent, but we still have a need. And so then they asked us to build them a field hospital of 600 beds at the Charlotte Convention Center. And the Charlotte Convention Center was the location that was selected because it was close to their, what we'll call their motherships, their primary hospitals, that would allow them to move equipment and staff relatively easily. And then at that time, the curve data indicated that we would reach our peak of cases in early May. And on that date, we had 744 cases. And this is important because what it tells us is that once the stay-at-home order went in place and people started to comply, you start to see the curve continue to flatten and get pushed out, which is exactly what we wanted. So that was actually pretty good news. But also in April, around April 10th or so, the data started to show us some disturbing trends. And one of those was that African Americans were disproportionately impacted by COVID-19. And that was something that was very concerning to us. And so our 2 hospital systems did a wonderful job and really stepped up and really started to expand testing on the east side and west sides of Charlotte, where we really needed to have it. And so that was one of the good things that happened out of that disturbing trend. And on that date, on April 10th, we had 913 cases. So on April 15th, I received another letter from our 2 hospital presidents, and they had worked really hard to build what they thought was enough surge capacity within their four walls to be able to handle any medical surge that would happen due to COVID-19. And when they withdrew at that time their request for a field hospital. On April 16th, our countywide stay-at-home order was set to expire. And what we agreed to, the county, the city, and the 6 towns, is that we agreed to extend our order to April 29th to align with the governor's order. But what it also did is it said if the governor extends beyond April 29th, our order would automatically extend and our restrictions would stay in place. And so this is at the time when a lot of the mayors and some of the towns were really starting to get concerned about the economic impact of what was happening in their towns, as were we. But again, we were able to get everybody to agree that we would do this one last step to align with the governor, keep our more restrictions in place for that amount of time, and to see where we were at the end of April. Again, this is a time where any town or the city or the county could have gone its own way. And that would have created a tremendous amount of confusion if you had different orders in different towns in the county and the city. Very confusing for people, and quite frankly, not safe. And so we were happy that we're able to get everybody to agree to stay on the same course. And on this day, on April 16th, we had 1,098 cases. On April 29th, the governor, as you know, extended his stay-at-home order until May 8th, and he also announced his 3-phase reopening plan. So our countywide order also extended to May 8th. And I think the governor's reopening plan was very thoughtful and it's data-driven, and it was something all of us could agree to, is that the metrics and the data will tell the story. Because that was one of the things that we always said, is that we will make our decisions based on the epidemiology here in Mecklenburg County. That what we're gonna do is make decisions that are gonna keep our residents safe. And on this date, the curve data actually showed that our peak was moving out until mid-July. Again, good news that the peak is moving out. And on this date, we had 1,528 cases. On May 8th, as you know, the state of North Carolina moved into phase 1 of the reopening plan. More businesses could open. Again, the use of face coverings is recommended if you leave your home and cannot practice social distancing. And phase 2 is expected on May 22nd. On May 8th, we had 2,007 cases. So where are we today? We have, as of today, we have 2,326 cases. We have 63 deaths, and we have not had a new death in probably about 4 or 5 days. And that is a real testament to the quality of healthcare that our hospitals are providing, because we are seeing tremendous recovery rates in our hospitals. 49% of those deaths were for folks that were in long-term care facilities. And we know long-term care facilities have been particularly vulnerable to this virus. We have 12 long-term care facilities that are still in outbreak status, which means they have more than 2 cases. And we have approximately only 50 people who are hospitalized at this point. So again, the capacity within our healthcare systems is more than adequate. The number of positive cases as a percent of total cases is flat. That is a very, very good sign. When we first started down this path, the percent positive as a percent of total cases was around 10 or so percent, and now we're under 8%. So that's what we want to see. We want to see us doing more cases, but the percent positive actually going down. Our curve has been pushed out to late July. Again, a great sign that we're continuing to push out that curve. We are doing more testing, and as you do more testing, you do expect the number of cases to go up. So we need to continue to track this percent positive number as well as our hospitalization number. We are planning to test 5% of our population in 30 days. That requires us to do 1,800 tests per day, and right now we're doing about half that. So we are getting ready to significantly ramp up our testing capability to meet, this is a state recommendation that we test 5% of our population in 30 days. But overall, I will tell you that I think the residents of Mecklenburg County did a fabulous job of complying with the order, practicing social distancing, staying home, and that I think has really helped us keep our numbers relatively flat, not where we expected them to be when we first started, but I think we've done a really good job of protecting the health and safety of our community and help flatten our curve. So that's the story of where we were and where we are. And at this time, I'm happy to take any questions.
Thank you for joining us today, Dena. We are really honored to have you and listen to your presentation. And thank you to all of our attendees who are here as well. We are going to open it up for Q&A now. You have a Q&A box in the bottom of your Zoom toolbar. Just make sure to submit your questions there, and we will try to get through as many as we can. So to start us off today, I'm going to turn it over to LJ for the first question.
You've put in that in your staff and the county is just amazing. The good news you shared with us is uplifting. It is especially very uplifting to hear that the number of people passing away in the last 5 days is 0. So we're delighted to hear that, and also about the flattening of the curve and the curve being moved to the flattening being moved to the end of July. But let me start with a curveball question, if I may. There's an unreleased report from the White House that indicates that the coronavirus is spreading in the hinterlands within the country, and there are hotspots. And thankfully, Mecklenburg and North Carolina are not among the hotspots, but they're indicated as parts of the country that should be watched as potential hotspots. Can you comment on that, please? Thank you.
Yeah, well, I mean, I think, as I said earlier, we're going to continue to watch our data. And if we see that, our data, starts to shift and go in a negative direction, then we will have to take some other kinds of action. I think that, we have the best data analytics people within our health department and within Atrium and Novant that will see something start to spike fairly quickly. I mean, one of the things that people need to understand is now that the stay-at-home order or the restrictions are reduced, it takes about 2 weeks for you to see any kind of spike. And so while things look good today, we're only a few days into that order, into that phase 1, we may start to see some things change, and we have to track that very carefully. I don't know how that report was put together. I haven't seen it, but again, we'll just continue to track our data here locally and make decisions accordingly.
All right, so a question from Dr. David Calloway. Can you discuss the unique aspects of the response in terms of the relationship and authorities between the city, the county, and the state?
Well, I think we developed, an infrastructure that you won't find anywhere else. I think the fact that we were able to get our city, our 6 towns, and the county to work so closely with our emergency management department, which is run by the city, and with state emergency management, made the lines of communication very clear. It gave us opportunities to really have some very robust discussions about what we wanted to do. And our hospital systems were key partners. They were at the table with us from day 1. And I don't think you're going to find a partnership that is that strong. I think anywhere in the state you won't see it for sure. But I question whether you'll see it anywhere in the country, to have such a very close group of people stay together from the beginning and work together to try to solve a problem. It was really extraordinary.
All right, we've got a robust 3-part question from WACC member John Gallus. What strategies are being planned and prepared by the county for CMS staff, students, and parents in order for schools to reopen? What monitoring, testing, and quarantining will take place daily, weekly, and monthly? And when will you begin testing countywide for employees at workplaces and public spaces?
Just taking some notes. We are still waiting to hear from CMS about and what the state plans to do about schools. We don't have any good information yet. At this point in time, I can tell you that we would not have the capacity to do a big, robust amount of testing at schools. And so we're going to have to see what the plans are going to be for returning to school. Right now, the plan is for schools to reopen on August 17th. We'll have to see whether or not that happens and what the plan is going to be in order to make that be successful. I think that's a huge question mark around schools. I will tell you that we are also at the county level starting to put together our reopening plan, and we are going to take a very slow approach to that. We are able to provide the vast majority of our services virtually, and we'll continue to do that for some period of time. There are some of our employees, particularly social workers, who under normal circumstances have to have face-to-face interviews with customers for certain kinds of applications, food, nutrition, and Medicaid, and they're operating under a waiver where those face-to-face interviews have been waived. We will continue to operate that way as long as the waiver is in effect, but if the waiver expires, then we would have to send some of those folks back to work. But we'll have to wait and see what the data tells us And we are going to do whatever we need to do to make our employees safe. We've ordered a ton of PPE for our staff. We are doing enhanced cleaning in our facilities. We are putting up plexiglass between cubicles. So we are starting that preparation to make sure that when our employees do eventually come back to work, that they do it safely.
We've got an anonymous question. Why has the public health department and county leadership not made wearing masks in essential areas like grocery stores mandatory?
That's a great question, and we've been getting there's a lot of discussion around face coverings, and we have decided to follow the state's order and the state's guidance, and right now the guidance from Dr. Cohn at the Department of Health and Human Services is that face coverings are recommended if you leave your home and social distancing cannot be accomplished. So that is the recommendation, and we're following that recommendation. I will tell you that there's a level of personal responsibility here that we would hope people would take responsibility to try to protect themselves and also try to protect other people. You know, I've gotten emails from people who have asked me that question, you need to make it mandatory. And then I've got other people who said, you know, if you do that, you're, you know, violating my constitutional rights, and are very angry about that. So this is a very controversial issue. And so we are going to continue to follow the state's guidance on this.
All right, so we've got two kind of similar questions. So the first is from Tom and Millie Cox, which is, what health concerns do you have regarding the RNC in August? And along those lines, we also have a question from Chase Saunders, which says, yesterday the national media was talking about watching Charlotte because it was a hotspot. Is this driven by data, or its focus on Charlotte as the host of a political convention?
So let me just talk a little bit about the RNC. We're getting a lot of questions about that. So there is a planning committee as part of the RNC planning work. There's a public health committee, and they are looking at public health aspects of all things RNC, not just COVID-19. And the RNC Committee on Arrangements has also hired a public health consultant to guide and advise them on how to pull off this convention in a safe manner. Whether or not the decision to go forward with the RNC, that is a decision that would be made collectively by a whole host of different people. It would include the city, it would include the Committee on Arrangements, it would include the Public Health Department, myself. So, and we're just not there. I mean, the RNC is not until late August, and we'll have to see kind of what the conditions are when we get closer to that date. In terms of the report about Charlotte, you know, I'm not sure what went into that report. I don't think the data on the ground today indicates that we are a hotspot, but if that's one of the reasons why they considered us a hotspot, maybe that went into that report. I just don't know. I haven't read it, so.
All right, we've got a question from Barry Christman. There is worldwide concern about unintentional underreporting of cases where people never reached the hospital, either battled it successfully or died at home. Do you share that concern, or do your total attempts capture that information? We don't feel that we're having an underreporting here. You know, we have not heard of anybody that died from COVID that, you know, didn't get tested or anything like that. We have not heard about that here. We are trying to do everything we can to make testing available to people to the extent that we can. So we don't see that as an issue here, no. The one thing that we do get, that we could be concerned about though, is that there's a number of people who are asymptomatic that have it and don't know it. Obviously they don't die, but that, you know, that would be considered an undercount because they're asymptomatic and hence they would never be tested. All right, you mentioned that 5% of the population will be tested in 30 days. How is that going to be identified, that specific population group?
So there's 3 phases, and right now phase 1 is the one we've been working under, where if you have symptoms and you are at high risk, you would absolutely be tested. The phase that we're going to be starting to go into in a few weeks is testing people who are considered essential workers. So for example, if somebody that works in a grocery store tests positive, right now we are not testing all the people that work in the grocery store. But under phase 3, we would go ahead and test all the people that work in the grocery store. So those are the kinds of things that we're looking at phase 3 in order to get to the 5% number. We will never be at a place where we are going to do widespread testing, that anybody who wants a test, symptomatic or not, or exposed or not, is going to be able to get a test. We just don't have the capacity to do that, and we won't have the capacity to do that. So it is a phased approach, and we'll continue down that path, and to the extent that we can do more, we can, but we are being very intentional about who gets tested.
All right. Are there any provisions to provide support to recent legal refugees until life goes back to normal and they're able to get a job and other support services?
Nothing specific that we're working on the county level. The city of Charlotte has a series of task forces that they're working on that may help in that regard, but there's nothing happening specifically at the county level for that population.
All right, so taking it back to our global mission a little bit, have you looked at other countries for strategies and ideas that work, like Thailand, Sweden, or Singapore? And can you provide us with any examples of what you may have learned from other international responses?
Well, I haven't done a lot of that because I think if you look at some of the other countries, they're still struggling to really come out of this. I think the one that we talk about a lot is South Korea, because they were able to do a significant amount of testing very early on, and I think that was a really incredible effort. And I think, you know, the more you test, the more you find, the more you contain. So I think that would be, I think, a best practice in the future if we ever, I hope not, but if we ever had to go through this again, that the ability to do a significant amount of testing early on is absolutely a best practice.
All right, we've got time for a few more questions, so if you will just submit them through the Q&A box. And we've got another anonymous question here. For the people who do not have healthcare insurance, who pays for the COVID test? Is testing done by private labs, or does the local government test as well?
So the government, we are not doing any testing, and the hospitals have agreed to pay for the testing. So if you are uninsured, there's no worry there. You do not have to worry about that. The hospitals will pay for the test. Your documentation status, your immigration status is not an indicator. So if anybody feels like they are symptomatic, they should go to one of the many testing sites that Atrium and Novant have set up to get tested, and they can get tested free of charge.
All right, we've got a question from WACC member Tally Brinzy. Is there any plan in place to reopen the courts for eviction filings?
So currently the courts are closed until June 1st, and we don't know if they'll extend that or they're going to open. It's probably likely that they'll open. It's not 100% clear, but that would be the time when those eviction filings would start. But there will be a tremendous backlog because there's been so many that have been in the hopper waiting to go in. I know that the United Way and the foundation, that grant money that they just announced, or that we just did another round of grants yesterday, and a good portion of money is going to go to help provide legal support to help with evictions once the courts open, because we understand that there's going to be a lot of people who are going to be going through that process once the courts reopen.
All right, a simple question from an anonymous attendee. Are you looking to recruit more PPE?
We always want more PPE. We have spent about $700,000, Mecklenburg County has, to just provide PPE for our employees. And it took our folks, it took them forever to source it. It's been really hard to get PPE. So we always need it. And if there's anybody out here that's got a source, they can either let me know, or they can go to the WOAD site, charmecresponds.org, and there's a way to put that information in there. But yes, we are always looking for PPE.
And another anonymous question. We have a large international community here in Charlotte. Can foreign visitors get free testing and care?
Yes, they're not asking you any questions when you go to get tested. So again, if you feel like you need to be tested, you need to go get tested. In terms of free medical care, it depends on where you get referred. That would be a question that I would refer to the hospital systems in that regard, but I know that the testing is free.
All right. Someone who is attending is interested in becoming a COVID tracer. Are you hiring for these jobs, and who should they contact?
So our public health department, we are doing a lot of training of our staff internally to be tracers. We have a lot of people that had been trained when we first started. We redeployed people within the department to be contact tracers, and we've also started to train our school health nurses, because they're not in school, so they're doing contact tracing, as well as some of our internal auditors are also being trained to do contact tracing. So we don't have any need right now for contact tracing. The state has a contract that they've entered into to hire 250 contact tracers to do contact tracing across the state. My understanding is that they got 4,000 applications for 250 slots. So I don't know that there's a lot of hope at this point to be a contact tracer here, but of course there may be other counties that are doing that. You could check, Gaston, Cabarrus, Union, some of our neighbors, and see if they might have some opportunities for you.
As we look to the fall, how is Mecklenburg County preparing for the expected second wave? Will it be different from the current response, and what might we do differently?
Well, yeah, there's a lot of talk about the second wave, and I think we all, maybe know that it's coming. I think we don't really know if it's coming or not. We have to wait and see. But I think we're much better prepared to withstand that because we know what to expect. So if we start to see a second wave and we needed to put some additional restrictions back in place, that's something we would absolutely have to consider. But I do think if people continue to social distance and wear face coverings when it's necessary to do so, and follow all the recommendations and the guidance, I think we can mitigate some of that second wave. I think it's all about what we do and the personal choices that we make, which will indicate how much of a second wave we actually get here.
All right. How do you personally feel about the reopening of businesses? And are there clusters of businesses reopening that are the most logical for each phase?
Well, I think the governor did a really great job with his phasing plan. And I think, we're at a point now where we know enough that we can reopen and we know when we would need to make a different decision. I think it's time. I think it's time that we let businesses reopen, put restrictions in place in terms of how many people can go in. And when you go to the grocery store and you can only walk up the aisle one way. I mean, those are things that have to go in place: cleaning, disinfecting, protecting employees. But I think we have to. I think we have to start getting back out there. And I think we need to be able to instill confidence in our residents that people are following those guidelines, and when they go out to shop, they're going to be safe. So I think we can do that. I think there's a lot of businesses out there that want to do the right thing, want to open their doors, want people to come in, but want people to be safe. And I think we can do that. I think retail was an obvious early step. I think the next phase, which is all the personal care type businesses, hair salons, nail salons, all of that, I think that's good for the second phase. That's another sector of the economy, which also includes food and beverage. We've got to start figuring out how we get hospitality back. But we need to start to think about our economy, but be safe. It's not going to be the same for a very long time. So we have to start taking the necessary steps to start rebuilding our economy.
Do we have, or might we have, a mobile phone app for tracing areas with a high precision of location and density?
Yeah, we've seen a lot about those apps. We haven't really taken a good look at those, but we probably should. They seem like they would be very, very helpful. We just haven't had the time to look at those yet.
All right. Will we continue to be county and state-led in our response? Is there a potential that might change?
I don't think so. I mean, I think, again, each town and the city and the county have the ability to go their own way. And so, for example, the town of Davidson is actually talking about putting more restrictions in place. As we've gone ahead and we've loosened some restrictions here, they are still concerned in Davidson, and they may go in a different direction. And we'll do everything that we can to support them in that. But I think that, because this is a public health crisis, the county would have to be the lead from a public health perspective. Now, what people do in terms of, their businesses and reopening and stay-at-home orders, those can be individual decisions, but we are the public health. We are required by the state to be the lead on public health, so we'll always have a lead role in managing the pandemic.
And a great question to end on: what can we do to help local organizations, art organizations like museums and opera, and local nonprofits?
Well, I know, I mean, I can tell you that I'm sure that any donations that you'd be willing to give will be very important to them at this time. I mean, having to cancel all their performances and close their doors has been incredibly damaging to our cultural sector, and they need all the support they can get. And when they are in a position to reopen, which for some of them may not be until phase 3, because we have to see what the mass gathering numbers look like and whether or not they'll be able to fill seats, they could be suffering for a very long time. So financial support, I think, would be awesome, as well as, once the doors open, please go to performances, and help them fill their seats.
Thank you so very much, Dena. This is amazing to hear how our county is getting together, unified in the response to COVID-19. We're hopeful that things will get much better and sooner than predicted. Thank you for your time. Thank you for all you're doing. I would also like to thank our participants today. Your questions were really interesting, and we all learned a lot about what our county, led by Dena, is doing in this battle against COVID-19. If you are not a member of the World Affairs Council, please do consider becoming a member. If you're a member, please consider a small donation. It's tax-free under the CARE provisions, and it would mean a lot. As the arts and museums, we had to close down our live events, our programs, and we do intend very strongly and with focus to continue our international education mission, but we need your help to do so. Once again, thank you all for being here. Thank you, Dena.
Thank you.
Our participants. Have a great day. Bye-bye.